one. Maybe come down here, Leo. When you find that spot that Jace had, wherever it is, and then we can just scoop it down the glute into there.
That whole line.
So yeah, it's almost like you kind of do your reconnaissance on the crest, and then you want to pin it and then scoop it down into like the gladius cranial or the top of the most. G'day guys, Aaron and Jason here. Today we're going to be talking about disc bulges. And in particular, a client that I had this week that was doing a lot of cycling, but had been experiencing some numbness in one of his legs. No back pain, but upon a scan, he actually had two disc bulges, one in which was L5-S1 down here, that was impinging on the nerve root, which was giving him the sciatica. So first, I want to explain what a disc bulge is, where it is, and then what I did with this person to help offset this and actually alleviate the pain in his leg, okay? So what we're going to do is come and look at the L5, which is this bottom vertebrae here, and the sacrum, which is S1. So L5, S1, and that little gelatinous sac in between that joint is the disc. And you notice that you've got these discs all the way up the spine, and they act as like a bit of a cushioning or a shock absorber to help our spine move. But what happens is, due to wear and tear, postural issues, injury as you age, sometimes these can wear down a little bit, and the gelatinous sac can actually just protrude or bulge back in that space there, in that vertebral space. And sometimes they can impinge on one of these yellow nerves here. And when one of these yellow nerves suffers a bit of an impingement or something touches it, then you get issues with the sensation, tingling, numbness, loss of power down the leg. And the goal of what we want to do is to remove that impingement, okay? And what I want to explain too is when you sit down a lot and when you're in a lot of flexion, I might hold him there, Jace. Can you just sit down on the bed here on the other side and just show what happens when you sit down a lot? So what happens is you go into what's called spinal flexion. And this is a completely normal position to be in, and it's fantastic. We want to be in spinal flexion. But what happens when you're in this position? Basically, all these vertebral joints open a little bit. And so what happens is the more open the back here is, the more closed off it is at the front. And so all the pressure in that disc actually starts to push back this way. And so if you have a bulge and you're spending a lot of time in that open position here, like Jason is right here, it just means that the pressure is coming back onto that bulge and potentially into that nerve root. Okay, I'm not saying that you want to avoid that completely, but in this cyclist case, he was spending a lot of time sitting for his job, driving for his job, and doing 130 kilometers a week on his bike. And he was training really hard, didn't have back pain. He's getting really, really fit, but the numbness just started getting worse and worse. And so what was happening was, because he was spending so much time in that position, I think that compression on that nerve root was just getting worse and worse. And so what I did with him was start with explaining this really thoroughly to him, so he had a really good understanding of what was going on. Because when you can marry up what's happening to you with what's actually happening beneath the skin, it can give you a lot of confidence that it's something that can pass, it's not permanent, and you just need to be given the right conditions to heal. And then what we're going to do with Jace is I'm going to show you the soft tissue treatment that we did on his body to help just free some things up. Because basically what can happen too is when you have that nerve compression on that area of your body, the muscles in the surrounding areas can become quite tight and angry. And so doing the soft tissue work was really important. But then what we're going to show you at the end of this video is the exercises I gave him to actually give him the opposite of what he was doing too much of, which is extension. So doing things that actually extend the spine like this, because what happens then is the joint at the back here actually closes off and this one opens up. Thus, all the pressure in that disc starts to go more anterior forward, thus taking some pressure off this nerve root here, okay? So I'm gonna show you what I did with him. And so if this is you at home, you've got a way better understanding about how to actually fix your own disc problem from home. Sorry for interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content, updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the Academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just $28 per month. How good's that? $7 a week. Let's go. So Jace, I'm going to get you to lie down first, mate. Thanks, Bones. Oh no, we'll get Bones up here. He can sit down, eh? He can watch.
Good luck.
He's had a
He
tough
might have
life,
a fall.
Bonesy. There you go. Come on, mate. You're all right. Beautiful. Okay, so we're imagining Jace has an L5 S1, a disc bulge. Similar to my client that I had, no back pain. He has a history of back pain, but not at the moment. He's only got referral down the leg. But what he did have was a lot of tone in these muscles around the back. Even though they were kind of stretched and elongated because he was spending a lot of time in flexion, there was a lot of tone there. So what we wanted to do was desensitize some of that tone, also work into the glutes a little bit, and then I spun him over and we did a lot of work into the hip flexors because he was spending a lot of time in this position doing a lot of cycling. A lot of the hip flexors there at the front were pretty jacked up as well, and those muscles are actually powerful stabilizers of the lower back, okay? And in this situation, we want to actually create more nice fluid movement in the lower back and the pelvis. We don't want things really frozen up, okay? So just releasing a few of the muscles around the pelvis was really important before we gave him some exercises, okay? So in Jason's case here, I'll just show you what I did. So we just wanted to decrease some of the tone around the areas here. So we just started with our just standard kind of lower back fascial strokes here. So just pinning into that lumbar kind of money spot region, but just doing some lighter work to just flush some of this tone in this region. And this stuff can be really kind of magic for people that have any lower back pain or any disc related stuff, because this stuff can be really jacked up. Sometimes the brain is switching these areas on to try and create stability and to protect it because it's sensing that there is like a bit of an injury or a discomfort happening in this region. So yeah, it's important when you're working with these customers, you start really slow and really light to just see what their capacity is. But once you start warming them up there and you want to start to get into some deeper structures, you can start to grab the elbow and just dig in and see what that's like there. So just pinning right down on that kind of L4, L5, S1 region there, pinning and holding and just taking some tone out of these muscles. How's it feel there, Jace?
Feels really good. Yeah, I've normally got quite a bit of tone in my erectors, so they're normally pretty hard to treat, but yeah, it feels really good to have them worked.
Yeah, so you can park there if the person's getting the sense that they really enjoy that. You can just park there a little bit, see if it maybe even refers some things down into the pelvis at all. But you're working with your client a lot when you've got these kind of people coming in. Yeah, you've really got to get guided by them and what they're feeling, because you know they've had a bit of an inflammatory condition in this region. You don't want to be pushing into things that are going to cause them more trauma, you know what I mean? You want to make sure you're in that therapeutic zone. So once I've been there a little bit, what you can do is if the muscles and the fascia guide you, you can start to potentially trace around that pelvis and out into that kind of oblique and QL space. Because sometimes taking the pressure from the spine outwards, it actually just releases all the pressure from in and around the spine as well. So it's a nice way to mobilize all this tissue. So taking it all the way around.
Oh, yeah.
Some gold in there, Jace.
Yeah, some good stuff out there.
And then you can even do some stuff up a little bit higher as well. So pin into just above that. So L4, L3.
Oh.
It's a little bit there, Jace.
In that, yeah. And yeah, depending on where the referral sort of sciatic sensations are, is like depending on what area you might target more. So say if it's more quad, then yeah, I think that's more L3, L4. If it's more hamstring down the back of the leg, that's more that L5, S1 sort of referral pattern.
Yeah,
so
exactly.
That's where we can more target with sort of what Aaron's doing there, specific sort of scoops away from that area.
Yeah, because as a massage therapist, you know, there's a few things that we're doing with the muscle. It's not just releasing a muscle, you know, we're taking it from high tone to low tone. We're desensitizing all the pain receptors in the region. We're increasing blood flow, getting the lymphatic system to work again to decrease inflammation. So there's a lot of different things that the soft tissue work does rather than just releasing something, if you know what I mean. So that's what you can articulate to your clients when they ask what's actually happening when you're pushing into these regions. You know, you can explain that and then they can marry up what's actually happening and why they feel better. Because then you can get them to buy in on why they should do their soft tissue work from home, get a lacrosse ball, get something hard, a roller, and do this stuff more often. So yeah, we've taken a fair bit of tone out of there, which is good for Jace. So we'll just do the other side as well. I won't come around to the other side to block the camera, but I'll just do the same strokes here. So you can even do things from the same side. You can do some knuckle drags in here. So similar to what I did before with the palm strokes, these knuckle drags can just emulate the same thing. You can kind of get the vision there that I'm actually peeling things away from the spine there, trying to take some tone out. It can be really relieving for someone that is quite compressed and inflamed in this region. And we're obviously going a lot quicker today because of the video, but yeah, you could potentially do this for 30, 40 minutes just in the lower back here and get guided by your customer in terms of what feels good for them. Because yeah, a big part about what we do is, yeah, that's why assessment is so important, is because you want to get your diagnostics right, really get a good picture of what's going on from that person, get a really good detailed history from their own words, what's going on from them, and then you've got to obviously put your professional opinion on. You've got to actually give them a hypothesis of what you think's going on and what they're missing. Do you know what I mean? That's what I did with this client. It's like, what are you doing too much of? What positions are you spending a lot of time in? Is that potentially feeding what's going on for you? And how can we give you stuff that's going to offset it? And in this situation, it was spending an awful lot of time in flexion. So can we offset it with some extension activity so he can continue doing what he loves? You know what I mean? We don't want him to stop cycling. We're loving that he's doing that cycling at the moment, losing weight, feeling really fit. But yeah, we want him to keep being able to do it. We don't want him to have that numbness down his leg and that loss of power. How's this side, Jace?
Feels good. Yeah, that angle there feels really good again.
It's a little bit different. I'm doing the same techniques practically, but just from a different side of the table. So it's kind of cool that you want to be able to emulate the same stuff, but wherever you are on the table, you don't want to have to always be in the same position. How can you hit different angles with different tools to create the same effect?
Yeah, it actually feels exactly the same as it did, even though you're on this side of the table.
Cool.
So it's good to experience as actually just being the client or the patient at this point.
I feel like with this one I can get a really good kind of crowbarring effect. I can just...
It's probably a bit easier for you to angle your pressure that way as well.
Yeah, it feels like I'm really able to hook down and into it. That's your L5 area. Go a little bit higher. Give Jace a bit of time to breathe. And then sink into that one.
Oh, yeah.
Ooh. Good in there too.
Good tucker.
Good tucker. Yeah, whenever you go to a new stroke as well, just allow your customer time to acclimatise to it, let them breathe through it. Because generally, it's quite painful for the first 5, 10, 15 seconds, but then once they breathe into it, it just dissipates, becomes more broad. A couple little twitches there for Jace, which is good. Beautiful. And one thing I didn't show on the other side was you want to really work into the deeper muscles in this region, which would be the QL. So the QL actually attaches to the transverse processes of the lumbar spine, the 12th rib, and then the pelvis there. And it's a powerful, stabilizer for the lower back. So when you have an injury or discomfort here, sometimes the brain can switch that muscle on to create protection, but then it doesn't need to be on. We need to actually release it to create more fluidity and then restore with different exercises. So with when you do the QL work, you can access it from going through the lumbar erectors, but sometimes it's better to actually come out to the side and then push in. Let's see if you can see there, Leo. I might use my different thumb pressure there. So Jason's got quite a bit in there.
And they normally are quite tight and really, there's quite a lot of twitch response in customers that do have this sort of condition.
Yeah. So you kind of come in from the side of that erector. So you've got iliocostalis, which is the most lateral erector in the erector spinae, and then you just push in from there. You can even go underneath it as well. But I always find that lateral muscle is always really jacked up, isn't it, Jay?
Yeah, it is, yeah. Which is, you can normally see when the erectors are quite, hypertonic and a lot of tone in there.
Yeah, it's good. Good angle. Try and use one thumb so you guys can see. already taken a little bit of tone out of it, which is good, but you've really got to come in from the side, just try and open up that space there. And this is one that you can give so much freedom to people. Like you do some QL work and you get them up and they just feel like they're unlocked, don't they, Jay?
Yeah, yeah. As you said, it locks on and stabilises, so they feel like they can't move. Like that's where you're limited in bending over or rotating through the lower back. So you release this and they stand up and go, wow. Like, yeah, they can sort of bend forward with confidence to touch their toes or try to touch their
better
toes.
Or something, can't they?
Yeah.
The ribs can expand. Yeah, Jason's actually got quite a bit.
Yeah, it does feel pretty tender there.
Just working through all those transverse processes there.
Oh, yeah.
Yeah, that's a good one there. So just to remember too, it attaches to the top of the pelvis, another little twitch there, but then up to the bottom rib. So you want to kind of work that entire space. Make sure you don't miss anything, if you know what I mean. So that's right up on the bottom rib there. Maybe not as much there for Jace.
Not quite, but there's there feels like there's something.
Yeah. That's good.
Oh.
Good spot there.
Good spot there.
So yeah, you make sure you do your QL work as well, guys. So yeah, just to recap, we did lumbar erectors. We did the QL, a little bit of obliques as well, but then we can move on to the glutes. So one of the muscles that can get really tight when you have an issue like a disc bulge can be your glute med, your glute min, bit of your glute max as well, and then the piriformis. And so when you're doing some global work before you do your specific, you just want to try and decrease the tone out of that whole region. So you can just kind of hook in from that top of the pelvis there, and then just pin in and
straight away
say good day. Jason's pretty toned through there, eh?
Oh yeah.
Bit in there, Jace.
Bit in there. That's twitching like crazy. I can feel it.
Nuts.
I'm trying to relax it.
Once you pick a spot, just park on it a little bit. Take some tone out of it. Allow Jace to assimilate with that, and then you can maybe reload and try a different area. A little bit lower. Yeah. Plenty of twitches.
Plenty of twitches. Oh, that's good.
Yeah, so if this is a real treatment, I probably might not even go that hard, or I'll back off a little bit, let Jace really relax to that. We don't want him tensing too much, you know. At the start, it's okay, just because they're getting used to that treatment, but eventually we want him to breathe through it, man. So a few deep breaths, and then let it all go, and let that glute go. See if you can, yeah, really good, really good. So that's where some cued breathing and guiding them is really important as well. You don't want to just be talking about the footy or the weather a lot of the time when you're doing this work, because you do want them to kind of get into that rest and digest space as well. Because, yeah, we want these tissues to change. We don't want them to be more arced up. Yeah, that's really good. Starting to relax a little bit there,
yeah,
Jace.
It is, yeah.
Beautiful. We can go down even a little bit lower as well. See what's down here in that more kind of piriformis zone.
Oh, yeah.
Still glute max, but then you've got some of the deeper external rotators as well. See what he's got in here.
I'm trying to let it go.
So big deep breaths there, man. Let it all go, man. Let it go. Good. Yeah, just trying to pin that piriformis right on the money there. A few more deep breaths, man. Big one in, big one in. And then when you breathe out, let that whole leg just relax. Good, man. Beautiful. What you can also do, I like to do a thumb trace around that iliac crest, just down a bit lower here, because you can really get into some of these juicy tendons of the glute med and then the glute min as well. And some of these just flick like crazy. So when they have trigger points in these regions, they can actually mimic the sciatica that goes down people's legs. So you always want to check these areas, because some of the stuff they might be feeling in the leg could just be pseudo sciatica or coming from trigger points in these muscles. So yeah, you never want to skimp on doing some of the stuff around the side in here.
Yeah, especially up through that area there. That sort of like refers a little bit even into the middle of my glute,
Yeah,
not necessarily
it's a really
down the
common
leg,
one.
but
if you have deep glute pain, a lot of the trigger points actually come from this region.
Yeah.
Some good stuff in there, isn't there?
Yeah.
Yeah, so always do some strokes through there. Where's that one that you said, man?
There.
Right there.
Now it goes like smack bang in the middle.
Middle of the glute.
Feels like there's an elbow right in the middle of my glute.
So that's how powerful these trigger points can be. So never forget that one. And then you can go all the way around too. And then the cool thing is when you find one, maybe come down to here, Leo. When you find that spot that Jace had, wherever it is, about there, Jace.
Keep going, keep going, keep going. There.
So what you can do is pin it like this, and then we can just scoop it down the glute into there.
That whole line.
So yeah, it's almost like you kind of do your reconnaissance on the crest, and then you want to pin it and then scoop it down into like the greater cranial.
Feels like the most.
Yeah, and there's a good nugget there, isn't there?
Just that little bit off it. Now
there. So that's why you're working with your client so good, because he's giving me the leads.
It's good.
Beautiful. So just like before, I'm going to come from this side of the table now and show you how to hit the glutes on the other side, you know, because sometimes you want to do glutes, but when you're on this side of the table, so you've got to know how to do that as well. So you can do some warm-up strokes like with your palm, just pinning into that iliac crest in there, and then just hooking in, and then making sure you're connected as you warm those tissues up and go down, trace down that space there. I can tell there's something coming up in there, Jace.
It doesn't feel as tight as the other side.
So what we can do is, hook the elbow in. Ooh. Jason's let out a little bit of something there. See if he's got something.
Oh, yep, there we go.
Something in there, Jace?
Something in there.
So this is like I'm kind of just tracing down and around that space between the iliac crest and then the top of the femur. Something in there, man.
Yeah. Oh, it's good.
Slowly tracing down. Know there could be some flicks coming in here. Just working with him and his breath.
Well, that bit feels alright.
It's okay in there.
More just up the top part.
Up the top. So what we can do is hook an elbow, find where it's going to be. I can feel it right there. Some good flicks. And then I've got to clasp my hands together here and then pull back into myself.
Oh, there it is.
So work into those trigger points and then just hold. Breathe there, Jace. Pretty brutal.
Not too bad. Once I can adjust to it, it's all right. It's just the initial.
Yeah. So taking tone out of this can be magic for people. But yeah, that's just some ideas of how to do it from the same side. And then you can also do a little bit lower into that piriformis where it comes off the sacrum as well. So figure out where you want to target there. And just lean over.
Oh.
There, bro.
Oh, I didn't even think it was too bad there.
Nice deep one.
Yeah, absolutely. Oh, a bit extra.
Yeah.
Bit of extra weight on that one, is there?
Weight, yeah, man. I'm put on 8 kilos a few guys, so it's a bit of a heavier treatment.
In 10 days, you reckon you put on 8 kilos?
No, I think it's been 6 weeks. I've put on 8 kilos, I think.
Whew.
But yeah.
Hello, Patreonos!
Patreonos! Check out our latest Patreon releases.
What? He's there. Come on, show your legs.
It's my turn.
Yep.
Right, I'm done.
Patreono pole dancing for you.
I'm going. All right, grab them.
To join, click the link in the description.
That's an idea for you there, guys. So what we're going to do now is spin Jace over and then work into some of the muscles at the front. Yeah, like I said before, because this guy that I had was a cyclist, cycling is very much a hip dominant. I mean, the hip flexor dominant, but I mean, when you're strapped in, you are using a bit of that pull as well, that glute and that hamstring. But yeah, historically, like a lot of the hip flexors are going to be doing the work. So remember, the iliacus and the psoas, they are very closely related to the lower back as well. The referrals are similar. The psoas is a really powerful lower back stabilizer, as is the iliacus. So if you've got lower back issues, always check these muscles here too. So we're pinning into the inside of the pelvic bowl, which is where the iliacus is here. So this is what I did with my man, and yeah, he was pretty jacked up in here. So just see what Jason's got here. I like to start with pin and release sometimes, just figure out where the most tight area is. Jason's going pretty good in here.
There, but not too bad.
Not too
It's
bad.
more just the standard level of discomfort
Standard
in
level
there.
of iliacus, yeah. Yeah, so you just work thoroughly the inside of that pelvic bowl there. There's probably a little bit more there for Jace, but
that
you're
feels
going
more
pretty
pressure.
good.
The other ones were a little bit more superficial. This one just feels good, muscular.
Nice pain there. Beautiful. Yeah, so you'd work all these regions here. You could even slightly get them to start rotating their leg in and out a little bit. That can be a nice way that you can make it a little bit more dynamic. Even bring their knee up a little bit there, just a little bit, and then back down. It's a cool way to kind of replicate that cycling motion there too, which is good. And then a similar thing, I'll show you how to hit iliacus on the other side. I like to do the fingers, so you dig into that space, kind of like you're doing a psoas, but you can kind of pull back.
Grip?
Yeah, pulling back into that pelvic bowl there. How's it feel there?
Feels all right,
Just
yeah.
okay. Iliacuses are good, man.
Yeah, very surprised.
Normally it's pretty brutal,
Yeah,
eh?
no, I'm pretty happy with that.
I'm very happy. Trying to think if I could show them something else. It's very much like you want to sink in, but then you're pulling down, aren't you?
Yeah, I sometimes still use a thumb. I have to think which thumb I use.
You could probably just do
I
it like
come
that.
that way
couldn't you? Yeah.
and flip my wrist around.
And then get Jace to start moving there a little bit too, yeah. Beautiful.
Pretty good.
Pretty good in there, man.
Yeah.
Very good.
Take that.
A little bit more there, maybe.
If you guys have ever had this treatment, you'll know it's pretty rare that people can sort of
Deal with it.
talk through this one.
Yeah, very good.
Psoas might be a different story.
Psoas might be a different story. That's what we're going to move on to now. So the psoas obviously sits a little bit more medial than the iliacus, but they all come and kind of join into the same tendon. So the way we can kind of hit it is by working into this space in here. So you've got to kind of bypass a lot of the superficial tissue, like the abdominals, the organs. You know, you can never really hit it too flush, but we can definitely pin it a little bit, even though we've got to go through a lot of other tissue in here. But the way I like to find it is just letting Jace bring his leg up, but the heel has to come up too, man. There you go, and then back down. Then I get a really good idea. It kind of comes to meet me. So make sure the heel comes up off the table, that's it, and then it comes to meet me. So, and then I can just figure out where I want to pin it. That's good, man. You feel that there?
Yeah,
Is that okay?
yeah, not too bad.
You've been pretty mobile over in Bali. haven't
Yeah,
you?
must have been. Maybe the warmer weather, I've been able to just soak up some sun, work on a little bit of a tan there.
Yeah. Proof's in the pudding, bro.
Yeah. Still managed to train, so that was good.
Yeah. So what we might do with Jace is actually do a few cycling movements. That's it. Imagine you're riding a bike there, Jace. There you go. I can really feel a long strand of a muscle there pinning back into my fingers when he's doing that. So I know that I'm on psoas or affecting psoas a little bit, flossing it. Beautiful.
In case someone kicks their knee out when they're cycling.
Yeah, that's it. Do a little bit of a
Some
karate
people
kick.
do a little bit of a... That might be a technique thing that you might need to work on if you're doing that. So just something to be aware of.
Beautiful. Awesome. And let's see if I can show them a psoas from this side of the table, eh?
This will be interesting.
This will be a good effort.
Because you've almost got to angle back.
You've almost got to
towards
angle
yourself.
in, but yeah, I'll see if I can Get a little bit of psoas through the abdominals there. So what I'll do is get Jace to raise his leg up there. That's it, and then back down. Definitely feels like a stronger sensation on the right side on the left side when you raised it up, but you can definitely still feel it there. How's it feeling there, Jace?
Just more abdomen-y than actual psoas-y. Hey, it's not too...
Oh, hang on a minute. There was something in there. Oh, yeah. This might be more iliacus, though, actually.
Yeah.
But yeah, you can still hit the psoas from the other side of the table. Maybe try that, Jace.
That's a bit more.
Bit more there?
Yeah.
Well, let's get him doing some cycling, eh? Beautiful. Now we're talking. There we go. I can feel that flicking. That's good.
Don't eat a big meal if you're going to get hip flexors worked on, guys. That's my one tip as well.
Beautiful, Jace. Nice. So yeah, there's an example of how I would treat someone with a disc bulge, just to free up the pelvis. And now what we're going to show you is the exercises that I would recommend as well. Okay, so Jace, can I get you to come and just go down on your belly on the ground here? So like we said, because this person was spending a lot of time in flexion, I just saw that they were missing some good extension, okay? Which is, can you just go up on your elbows? Right? Yeah, perfect, like that. So you imagine at the start, how I showed you when a person sits down, spends all day sitting, especially cycling, their pelvis just drops under into a bit of a posterior tilt and they go into a bit of flexion. But this position right here, just Jason spending time in this position, it's allowing those joints to spend more time in extension, okay? Because imagine like a tabletop like this. If we open up like that, all the force and the pressure is going to go into the majority of the space, okay? And vice versa, if I go like this, all of the pressure is going to be coming this way. So if you've got a disc bulge in this section here and you sit down a lot in flexion, you can imagine all the pressure of that disc is going to be going into the majority, which is where the bulge is. Okay, so the more you sit, the more you're potentially feeding that pressure. Whereas if you start to spend a little bit more time in extension, where the disc bulge is, a lot of that pressure of that gelatinous disc is going to be going the other way. Thus, you could minimize the pressure on that disc bulge. Okay, so this is what we're giving with Jason here. We're letting the joints open up into a different space. And so with this person, I said, when you're watching TV, when you're just chilling at home, try and spend a little bit more time like this because you're getting some incidental extension, okay? Now with the reps I gave him, the actual exercises, it was a little bit different. It was kind of like the Mackenzie extensions or the Cobra extensions. So Jace, can you just put your hands on the ground just about out here? And what Jason's going to do is just start to extend his elbows and go up into extension there. Perfect. And so with this, you kind of want to just relax all these muscles, relax the glute. And what I say is try and get a stretch in the abs. So if you think about the abs stretching more than this kind of, not jamming, but compressing, that's a good thing for you to have that mind-body connection. And then back down from there, Jace. So maybe just do a few reps there. Beautiful. So you see this nice extension happening. Try and let these muscles relax there. And you keep the pelvis on the ground as much as you can. All right. And basically, a good thing to think about is, see where Jason's got his hands there? That might be a bit too much for you to start on because it feels so awkward going into this position. So the further out you have your hands here, I guess the easier it is because you're not required to do as much extension. But once you start getting proficient at it, you can bring your hands closer and closer in and you're just going to accentuate the amount of extension that you're getting in here. And remember, if you've spent a lot of your life in flexion, you're a cyclist, you sit down a lot, it's going to feel a little bit awkward or clunky when you first start, but don't let that stop you from doing it, because what you'll find is after you do say 3 sets of 10, it'll feel really good, it'll feel all oiled up, and you could potentially get a big change in what's happening in your leg or legs because you've changed the pressure in that disc and you've taken that pressure off the nerve root, which is causing the tingling and the numbness down the leg. Okay, so what I've given this guy is to just do this 3 sets of 10 twice a day. Whenever he's sitting down, put a rolled up towel in your lumbar there. So when he's driving or sitting in his office, put like a lumbar support there, because that means you're going to be in much more extension rather than dumping into flexion. Continue the soft tissue release. And I guarantee you he's going to get a great result by taking that pressure off. And so the point of this video is just to not make you worried about when you have a disc bulge. You know, they can pass, they're not permanent. You just get the right soft tissue work, you get the right advice, put the right stimulus and input into your body, and it can go away. Okay, so I hope this was helpful. And just start these exercises. Even if you have some back pain, had some kind of sensation changes down the leg, start trying to do this, and I'm keen to hear how you go. But thanks for joining us, guys.
Thank you.
Thanks, Jace.
Always.
See ya.